So in terms of new cases, 113, almost all of those, as has just been reported by Premier Andrews in Victoria, they are cases from Melbourne. There are 5 cases also from New South Wales in that new figure. They are all overseas acquired and in hotel quarantine. The total deaths remain unchanged, 104 since the start of the pandemic here. Almost all of the cases have recovered, but that rising number of active cases in Victoria is the major concern at the moment. In terms of hospitalisations, there are only 29 people hospitalised in Australia at the moment with COVID-19, the majority, again, in Victoria, 25. In intensive care, there are only 4 people in intensive care throughout Australia. 3 of those are in Victoria. The number of tests continues to rise, over 2.6 million tests in Australia, over 50,000 tests in Australia in the last 24 hours, and again that very large and impressive figure in terms of testing in Victoria, over 25,000 in the last 24 hours. The issues obviously at front of mind at the moment is that expanding number of cases in Victoria. I would certainly say and agree with our colleagues there that we shouldn't take a single day as an issue in terms of raising cases, but this is has been a trend now for the last week or more, and certainly the number of cases rising particularly in that northern and northwestern part of Victoria of Melbourne is a great concern, and just to reiterate that whilst it's a problem in Melbourne, it is really the whole of Australia is here to assist in relation to the response to that outbreak as it's emerging in Melbourne. This is really important that we see this as a combined effort to assist our Victorian colleagues in whatever way that we can. And that has already happened and continues to happen in terms of clinical resources, of laboratory resources and public health resources, both on the ground and in terms of contact tracing, for example, assistance from New South Wales in particular in the last few days to assist with that contact tracing effort. The way that this will become under control is very clear. We know how to do that. It is being led by the data, and we are taking those 3 main ways that we can approach this problem to control it. That testing, trace and isolate piece is absolutely crucial, fundamental public health response, and that is happening right now on the ground in Melbourne with those assistants, as I've mentioned. The physical distancing measures that have been introduced in those lockdown suburbs is also an important component, as is movement restriction from places where we know there is more transmission so that is not spread further geographically. So 2 points on that. I think the fact that the Premier has now announced just in the last few minutes that they are expanding those lockdown postcodes to 2 more postcodes in Melbourne, led by what is happening in terms of the number of cases that have been identified. That is a totally appropriate response, and we certainly support that. Second of all, and this is could be seen as a major escalation in what is being done, is for the first time in Australia an actual complete lockdown of those public housing tower blocks in North Melbourne. I know those tower blocks very well. My son used to live within eyesight of those tower blocks, so that will be a very difficult but important step. We know from previous pandemics, the SARS pandemic in 2003-04, that it was a tower block which was part of the major spread of that SARS coronavirus. What was from a tower block in Hong Kong. So taking this step is a big one for the Victorian authorities. We've heard just now about how difficult that will be and how important it is that the supports are there for the people living in those tower blocks, and that will be an effort which is definitely worth doing in terms of controlling the spread of the virus throughout Melbourne. So we stand ready to assist. On that basis, I spoke to Minister Hunt just an hour or so ago, and he and I agreed that I should call an emergency AHPPC teleconference. We'll be meeting again at 6. We'll have only one topic on that agenda, and that will be to discuss the Victorian situation, to hear from our colleagues there, but most importantly to reiterate that we stand ready to support our Victorian colleagues in whatever is necessary to assist them in this control.